My name's Tom Green. I'm a retired deputy chief out of City, Virginia Beach, Department of EMS. Started my career in Chesapeake Fire Department and moved over to the EMS system in Virginia Beach. Did 31 years, retired out as the operations chief, but very data-driven organization from the beginning. EPCRs, NEMSIS data wasn't even on the map at the point in time that we took over this project in 2007, where we started looking to really find out where we were as an EMS system. Where were the efficiencies? Where were the lack of efficiencies? How are we doing with patient care? In other words, how do you tell that, you know, your simple chest pain patient was treated appropriately? Did they get the right treatment? And then one of our drivers was always getting outcome. In other words, we were flying blind mostly as an EMS agency, where we would drop a patient off at the hospital and have no idea how they did months or days later, other than calling back to the ER and trying to get a little bit of information. So one of our main drivers with going with an electronic patient care reporting system was to benchmark our performances and KPIs, and we simply had no way to do it on 3-part NCR paper. So early 2007, we kind of got the idea, tried to find a little bit of funding wherever we could in the city, so it wasn't a very big initiative. So really where we made strides was connecting with our IT department. We realized we had to be connected. We wanted to report at bedside, had no idea of the vendors in the space. We'd heard of a few of them. So we took a team of folks down to Florida, simply because logistically it was simpler to go county to county, and all the counties had different reporting systems. So had never heard of ImageTrend before. The last county we went to, which was Lee County, Florida, had ImageTrend, seemed to be very satisfied with it. It seemed to check our check marks on the ability to report and benchmark. And that started our journey down ImageTrend path. Obviously, we have to competitively bid, so a couple of vendors came in, and the only vendor in the space that said you must do things this way, instead said, have you ever thought about reporting like this? That began a conversation more on not so much a business level, but really a personal level, because the folks that were in the room had run EMS before, so they knew what we were talking about, as opposed to the other vendors seemed like they were just trying to sell a product and pigeonhole us into the way that their reporting system worked versus the way our paramedics worked. So ImageTrend became a front runner. We actually flew up to Minneapolis to make sure it wasn't a mom and pop, shadow company in a garage. And actually that's where they started out, and immediately connected on the humanistic level, which is super important to providers. So from that point forward, we were able to procure it, luckily, through a couple of grants and some, manipulative budgeting processes, and started a project off that really no one thought we could pull off in the city. Having IT in our city being sort of proactive really helped us connect so that we could be online and get in as near real-time data as possible. But back to the point of getting outcome data back to hospitals, it's always a give and take between the healthcare system. So we supplied them patient care reports that were paperless, that right off the bat saved them tons of money in paper and scanning and sending it to medical records. ImageTrend stepped in and did an integration directly to medical records, and that really set the stage for us to be able to get PCRs to the hospital, then outcome data. The end result of that really was a massive amount of data, and now what do we do with it? How do we structure it? So we started a benchmarking process that really mirrors Mission Lifeline's sort of statistics before Mission Lifeline was ever there. What it did for us on the insight level was allow us to adjust staffing to peak demand response times calls, for example. It allowed us to measure how successful we were on skills that were performed, those low frequency, high-risk calls that you don't always go on. And our idea was to take those benchmarks, turn that back to our training department, and see if we can improve every day, every step of the way. The big part that ImageTrend lent to us was the ability to take the data and actually turn it back to the provider side, so that the providers had insight on what they were doing made any difference in the field. Probably 5 of our most major calls that we go on completely changed the way we responded to them, based on distance and times. The next biggest thing that came into that was integrations with other software systems such as CAD, which became huge for us to get times that were realistic instead of whatever time I thought of the day to put in. Now data started to stack up to be very linear. From that day forward, our department had just exploded. Data Mart came into the scene, a data analyst, and then more data came out. So we really started to drive operations. More so than clinical, we really drove where we staff people, what hospitals we go to. So in the end, at the time of my retirement, basically they had a whole playbook to go by so that any new employees coming in would get the data, they see where they stack up, and they sort of started to fit in that mold. So it was a pretty well-oiled machine at the time. Since then, I decided to retire after 31 years. About 2 days after my retirement, I got a phone call from one of my friends at ImageTrend who we've known for a long time and said, hey, have you ever thought about maybe coming to work for ImageTrend? I wasn't aware there were any job openings. Came up here on an interview, didn't even know what job I was going to apply for. And I remember Laura Shire and me sitting me down, the HR professional, and said, you know what? You're really not slated for that job. We want you out in the field talking to clients. And that was an easy decision for me to do. And most of the people here at our Connect conference that I see are people that I've seen for 15 and 20 years in the industry that are still on ImageTrend, and very proud to be here. And I think it's just the best solution on the market.